Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome to today's episode on the How to Be Well and Strong podcast. Today, we are speaking with Dr. Carolyn Stone about a commonly undiagnosed disease that can become quite serious, especially when left unaddressed, Hashimoto's. Dr. Carolyn is a naturopathic physician who empowers women with Hashimoto's and hypothyroidism to take charge of their health and create a life they love. She's the author of Hashimoto's, You Got This, has been a guest on numerous podcasts, and recently started the Love Your Thyroid blog. She runs a private practice in Tempe, Arizona, and also offers virtual group coaching to people near and far. Her ultimate goal is to educate as many people as possible on thyroid disorders so they can thrive. Dr. Stone, welcome to the show. I have been waiting to discuss this topic with you for quite some time now, as I was just sharing. I myself have experienced some symptoms from a thyroid-related disorder back in the day, and I know that there are so many others walking around with Hashimoto's or other thyroid disorders that may not even realize it. So I'm excited to really dive into this area with you.
Yeah, and as you know, this is my bread and butter. This is what I love to talk about. So I'm always happy to educate people, right? That's like part of, a big piece of what I do is just educating as many people as possible so that they can get the help they need. So thank you for having me.
Absolutely. So let's start from the beginning. What is Hashimoto's disease and what are some of the common symptoms that present with it?
Yeah, great question to start with. So Hashimoto's is an autoimmune thyroid disorder. And gosh, at least in the US, over 90% of hypothyroidism cases are actually Hashimoto's, and many of them are undiagnosed because they're not properly tested for, which I'm sure we'll get into. But when we look at the differences, hypothyroidism is really a disease of the thyroid, or really that pituitary thyroid axis, versus Hashimoto's is a condition of the immune system, right? Because it's an autoimmune disorder. So the distinction is really important because how you address an immune system dysfunction versus a thyroid dysfunction, those are two different things, right? So autoimmune thyroid disorder. And what's happening is that, and we'll go through, the three-legged stool of autoimmunity, I think, here in a little bit, but what's happening is that the immune system is not recognizing your thyroid cells as belonging to you. They're looking at the thyroid cells as if they were a foreign invader, like a bacteria or a virus. And so it mounts an immune response to that. And then it starts to attack those cells, can destroy those cells. Now, cells will regenerate, right, up until a certain point. But if the attack is too great or it goes on for too long, then that's where, more cellular destruction happens and you can develop hypothyroidism from there. So treating the immune system is really important piece of Hashimoto's because you have to make sure you get that part under control. And, I use the term, attacking the thyroid. I don't really like to use that terminology, right? I don't like people to think about their body as attacking itself. Really what's happening is your immune system is just responding to the environment. So I kind of like to rephrase that because I don't really like to use that terminology of body attacking itself. So people have Hashimoto's, the symptoms can really range a lot. A lot of them will mirror or be similar to hypothyroidism symptoms, but people with Hashimoto's can have hyperthyroid symptoms as well. But I would say some of the main things that I see are going to be gut issues. So constipation's a big one. So I always think about everything's kind of slowed down, right? So gastrointestinal system is slowed down, causing constipation. Could even be things like heartburn, gas, and bloating. Fatigue is huge. That's probably the number one presenting symptom that you'll see with people who have Hashimoto's is just this unbearable fatigue. And along with that, something we call brain fog, which, not everyone really understands what that means, but if you've experienced it, you know what it means because it's literally like you're living in this fog. So just not clear thinking. Yeah. Difficulty concentrating. Once you learn that term, it's like, oh yeah, that makes a whole lot of sense. So brain fog for sure. Dry skin. which here in the desert, it's always a little bit hard to tell because we are in a desert, but dry skin is definitely a big one. Hair loss, and that can be loss of head hair, also the outer third of the eyebrow. That's a big one, and one that I've always struggled with. Yeah, super interesting, right? Because I always was like, man, why is like this outer part, like for a while, it almost looked like I was shaving it. And then when I realized I had a thyroid disorder, I'm like, oh, that's what it is. And let's see what else. Irregular periods. So for women who have Hashimoto's, which it's mostly women that have this, having abnormal periods. So that could be heavy periods, painful periods, or they're just irregular, like not coming on a regular basis. And PCOS is a very commonly, so polycystic ovarian syndrome, very commonly seen with people who have Hashimoto's. So all the things that can come with that too, right? Cold intolerance is a big one. So people who have Hashimoto's, like painfully cold. Once you get under better control, that actually gets better. You're able to tolerate cold a little bit better, but beforehand, yeah, it can be really painfully cold. So I would say those are like the big ones that I look for.
Yeah, that's all fascinating. And quite honestly, hindsight's 2020, right? But just hearing you go over a lot of those, I experienced a majority of those symptoms back in high school. And, particularly like the cold intolerance, the brain fog. And I just figured, oh, it's fatigue, tiredness, nature of being a high school student. But it wasn't until I visited an integrative doctor that I was told I had hypothyroidism. And at the time, too, I also suffered from PCOS. And again, our bodies are incredible. Everything is related. And I'm just fascinated with learning the connection between PCOS and thyroid disorders. And it's all related.
Yeah.
Putting the puzzle pieces together when you start to realize our bodies are incredible. And when you address, the root cause of an autoimmune dysfunction, all those symptoms basically just, fade away at some point. Or at least that's the hope it has for me, which has been great. But with that, so aside from symptoms, how do patients ensure that they're being properly tested? And I know there's been some ongoing controversy about what levels are considered normal and abnormal, in addition to the fact that, the early stage of thyroid disorder blood tests might not reveal anything is wrong per se, because levels of T3 and T4 might appear normal. So how do patients parse through that and navigate that, especially, since let's start from the baseline, assuming they don't know anything about thyroid disorders. How does one go about discovering if they have one?
Yeah, that's a great question because this is really a big deal because as I mentioned earlier, so many people go undiagnosed with Hashimoto's. It's not until their disease has progressed enough that they've developed hypothyroidism that they even knew they had a thyroid disorder. So what happens? Why, the question is, why does that happen? So in the conventional system, when a primary care physician, a conventional doctor is screening for thyroid disorders, basically they're just running a TSH or thyroid stimulating hormone, which is such a small piece of the picture and does not at all indicate whether or not you have Hashimoto's. So TSH is a hormone produced by the brain. When that's produced, TSH, its job is to then stimulate the thyroid gland, which is in the neck here, to make T3 and T4, which are our active thyroid hormones. So even just looking at that piece, like if you're just testing TSH, you're missing what the thyroid gland is actually producing. Just because it's sending the signal doesn't mean the thyroid's listening, right? It's kind of like a little toddler. And sometimes it doesn't like to be told what to do. Yeah. So, even if they're just running TSH, they're missing that picture. But even those tests won't tell you if you have Hashimoto's. It's the antibodies that you have to look at. So that's a piece of it. So the majority of people who have Hashimoto's will have either positive TPO antibodies or thyroglobulin antibodies. And rarely do I see primary care physicians run that. And even endocrinologists can miss that too. And then even just looking at those, interestingly enough, so Sonora Quest, just to give an example of why this gets tricky, their reference range for TPO antibodies used to be less than or equal to 35. At some point, I think it was like last year, maybe a year and a half ago, they changed that to less than or equal to 60. No explanation, right? It's always interesting to me when they change reference ranges without any explanation. So a lot of us who specialize in Hashimoto's and thyroid disorders, especially functional naturopathic type doctors, we're still going by that old reference range, right? Even if I start to see somebody's antibodies around like 20, it piques my interest and I start paying attention. Some people I know Isabella Wentz even will have even a tighter reference range for that. I usually will monitor it, right, until it gets to a certain point. But for me, if it's above 30, I'm assuming it's Hashimoto's at that point. Now, I would say the majority of people. So, there's maybe like 2%. I don't know how accurate that is, but I think that's around like 2% last time I read, that they will not have positive antibodies, but they still have Hashimoto's, right? So it's like seronegative Hashimoto's. So what I do in some folks, if I'm really suspicious that they have Hashimoto's, but their antibodies are normal, I'll do a thyroid ultrasound, because oftentimes you will see evidence of it on there. Again, not like a perfect diagnosis, because, let me go through some of the things we look for. So your thyroid should be nice and smooth, right? But if it has this lumpy, bumpy texture, which we call heterogeneous tissue, that can be an indication of Hashimoto's, but it doesn't necessarily rule out other reasons for that happening, right? It just tells us there's an inflammatory process, which oftentimes is Hashi's. And oftentimes you'll also see things like the thyroid gland might be enlarged in Hashimoto's, but there could be other causes for that. You might see cysts or nodules, but again, there could be other causes for that. So that's where it gets a little bit tricky, are those people who don't have positive antibodies, but they have all the signs and symptoms of it. So yeah.
That was my question. So I have a family member who actually she gets her thyroid nodules biopsied quite often. And my question is, I mean, you hit the nail on the head. Like, is that necessarily an indicator if she's also presenting with symptoms, of Hashimoto's? Would that maybe most likely be the reason why?
Yeah, like oftentimes if it looks like a duck, quacks like a duck, I'm going to treat it like a duck. So if it mimics everything that looks like Hashimoto's, and we've ruled out other things that could be causing those symptoms or that presentation, then I will almost always treat it as if that's what's going on. And then you kind of just have to play with it and see what happens. But you do have to do, as a practitioner, you have to do your due diligence and rule out other things that might be causing it. But yeah, it's not, I've seen a handful of cases like that where it's like, okay, it looks like this. And sometimes later on, their antibodies will come up positive. And then it's like, okay, just like we thought.
Right.
Yeah.
Interesting. And I heard you talk about the theory of like the three-legged stool of autoimmunity, or the three underlying factors that present in the majority of autoimmune conditions. Can we spend some time exploring what each of those legs are? Because I find them fascinating, and I think our audience would as well.
Yeah, I remember when I first read about it, I was like, oh, that makes so much sense. So this is a concept that was developed by a gastroenterologist. I want to say it's like Dr. Fasano. I don't know if I'm pronouncing that
Yes,
correctly.
I actually saw him. He worked at Mass Gen in Boston, and I
Yeah.
remember upon finding out that he worked there, I at the time was dealing with leaky gut, and I was like, I'm gonna make an appointment with the founder of Leaky Gut. So we had quite the conversation. I'll fill you in on that later. But yes,
Yeah, that's awesome. Yeah, you'll have to tell me about that. So yeah, he's the guy that kind of came up with this concept, and the rest of us have kind of run with it because it just makes sense. So the three parts of the three-legged stool are going to be, so what does this mean, right? When we say the three-legged stool of autoimmunity, what we're saying are these are the three things that are going to be present in people who have autoimmune disorders. And I see this play out time and time again, which is also one of the reasons I've kind of grabbed onto this idea. So the first one is a genetic predisposition, meaning that someone in your family has an autoimmune disorder. Now, this can be kind of tricky because how many autoimmune disorders go undiagnosed, especially Hashimoto's. So even if somebody doesn't know they have a family history, that it may be there. So genetic predisposition is the one piece. The second one is going to be there's got to be some type of a trigger. So that could be a stress, mental, emotional stress, physical stress, right? It could be a toxin exposure, like environmental toxins or heavy metals or something like that. So any type of trigger, something that sets it off. And then the third piece is going to be leaky gut or increased intestinal permeability. And so when each of those is present, then someone's very likely to develop an autoimmune disorder. So, the genetic piece, well, we can't really, do much about that, but what we can do is alter how our genes are expressed, right? And we do that a lot through what we eat, which is going to impact leaky gut, right? And we also know that many of the triggers that will be part of Hashimoto's and autoimmune disorders also impact leaky gut. So these things really all kind of work together. Even though they seem like separate things, each one of them is just like a moving piece of the puzzle. So like when we look at leaky gut for people, I don't know, I guess you're new on podcast, but you probably talked about it on your blog, right? So leaky
Definitely.
gut, Yeah, I was like, this has to be covered at some point. So yeah, leaky gut, meaning that
Essential.
there's yeah, right? You have to do it. But leaky gut, meaning that there's inflammation in the intestines and there's space between the cells where there shouldn't be, so things can move through the intestinal lining that wouldn't normally do that, and that triggers an immune response because your immune system sees something where it's not supposed to be. So it all really works together. Does that cover it? Does that make sense the way I explained it?
Absolutely, 100%. And I did also just want to emphasize to listeners as well, I'm fascinated with the field of epigenetics. And I think so many people today sadly think, oh, I have this genetic predisposition, I'm going to get this disease. No, that is not true by any means. Check out the field of epigenetics. I use the analogy that genetics might load the gun, but environment and lifestyle pull the trigger. So it's all about, like you said, lifestyle, food, mental health, emotional health. Those will all determine whether or not those genes are expressed. And I think there is so much power in that. And when people realize that, it really does change their health overall, and the outcome of any possible diseases they may otherwise have been carrying genetically that again are not expressed because of the lifestyle they're living.
Just helps change their mindset around it, right? Like instead of thinking like I'm a victim of this condition, right? Or that I might be a victim of this condition. It's like, no, I actually can, there's something that I can do about this. So I think it's very empowering.
Exactly. And to that point, I really appreciate and agree with that unique perspective you have. And I've seen you share this a lot on your social for people living with Hashimoto's, which, cultivates an attitude of gratitude rather than that, why me approach in managing the illness. And I felt the same in high school. I dealt with a lot of these issues, hormonal imbalance. I felt crazy. Was put on birth control for a while to try to, ameliorate some of the symptoms, but didn't help. And I learned a lot again just through my own personal journey with that. But the beauty is looking back, you change that perspective, and instead of why me, you learn to deal with it. You learn to address the root cause. And again, it just has this spillover effect into every other area of your life. So could you share a bit more about that mindset?
Yeah, I think mindset is one of the most important pieces of dealing with Hashimoto's because, speaking from a personal perspective, I've had Hashimoto's for quite a while now. And yeah, in the beginning, I was like, man, can't eat what I want to eat, can't, my body hurt, and you just, again, going back to that victim mentality, that why me? And yeah, it sucks, right? Like I don't get to live life the same as other people, but when you find what works for you, there's so much freedom in that because you feel good. And so if you can change how you look at your condition, like me, I don't think of myself like, like I hear people say like, oh, I'm a Hashi's girl or whatever. And it's like, well, yeah, I'm a person who has Hashimoto's. I think of it that way. Like, yeah, it's something that I deal with, but when you learn how to manage it and you learn how to take control of your health and you learn how to ride the waves, because that, I mean, with autoimmunity, you really have to just ride the wave sometimes, because sometimes you're going to be triggered and you're going to be in a flare and you don't know what you did or what happened. And it's like, okay, well, this is what my body's doing right now. What can I do to make my body feel safe and loved and well taken care of? So if you look at it from that perspective, rather than I'm mad at my body for doing what it's doing, it really changes. And I don't know, maybe it's a little woo woo, but I feel like our cells really listen to us. And so when we are, whether it's just in our head, whether we're saying it in our head or we're saying it out loud, if we're saying things like, I hate my body, or, I don't like what my body's doing to me, that our cells respond to that. So I'd like to change that perspective, even if you don't believe it at first, right? It's kind of like affirmations. You just say it until it actually feels right. Yeah.
I am a huge affirmation person, Dr. Stone. I truly believe, our bodies listen to what our mind tells it. And there's been just so much literature and studies. Outside the topic of Hashimoto's, I recall reading a study of cancer patients, and they separate them into two groups. One group was given chemotherapy, the other was given a placebo. And in the placebo group of the patients who thought they were receiving chemotherapy, I think it was like 70% of them actually lost their hair, which was
Wow.
mind blowing, right? Just the power of the mind and thinking, oh, this is what I'm going to be given. This is what's going to happen, and how our bodies react to that. It is beyond fascinating. And I'd love to have another episode just exploring that topic itself. I couldn't agree more with that.
Yeah, yeah. And that's such an interesting example too, because when I was in med school, I remember my attending physician, he mentioned a case where he was treating a woman with cancer, and she was doing really well, thriving, kind of blew her oncologist out of the water. Like, he had no idea. And then she had gone back at some point, and he's like, whatever you're doing with that, holistic doctor, whatever, it's never going to work, and your cancer is going to come back. And her cancer came back. She got depressed and it came back. And I can't explain, how that happened, other than this was a mindset thing.
I resonate with that a lot. And that's something I really emphasize to my mom too. Never, and anyone who's listening, never take what your doctor says as gospel, like reject it. Take everything with a grain of salt. And if you have a doctor who isn't speaking good things over you, leave.
Yeah.
And again, that's why it's so important to work with a practitioner who supports you, who has a positive outlook on life, because that makes a huge difference in your care journey. It truly does. So definitely something to look out for. So we know that this obviously, our immune systems play a huge role in the development of this disease. Have you seen in your patients situations where they were actually able to reverse Hashimoto's by healing their gut?
It's a great question. So I would say, because I'm a little bit nuanced about terminology, right? So people are like, okay, can I cure my Hashimoto's? Can I reverse that? I like to use the term remission, because the reality is, right, if somebody, let's say, is eating a standard American lifestyle, and then they clean it up, right, and their gut's healed, and then their Hashimoto's goes into remission, if they were to go back to that lifestyle, their Hashimoto's is going to come back. Right. So it doesn't really go away, but we can put it into hiding, so to speak. So yes, you can definitely get Hashimoto's into remission. And I think the interesting piece is, what does remission actually look like? Because I mentioned earlier the antibodies that we test, right? So some folks will say, your antibodies have to be at a certain level before you're considered remission. I actually don't agree with that. I think there's a lot of information telling us that the antibodies are not actually an accurate and reliable indicator of the severity of disease. So I have people whose antibodies are over 1,300, but their energy is great. They're able to exercise without pain. Their weight's well maintained, not on thyroid medication, right? Ultrasound normal, and they feel great. And then I have people whose antibodies are just barely elevated, and they are suffering tremendously. Can't get out of bed in the morning, gaining weight, all those types of things. So I think antibodies are not a great marker for that. And the reality is it's actually the T cells, which are cells of our immune system. Those are the ones that are actually going after the thyroid cells. Those are the ones that are causing cellular destruction, not the antibodies. So that's not really something that we can measure in labs. Like, they can use it in research, but it's not something that's like readily available to test. So for me, remission looks like symptoms under control, minimizing, if they're on thyroid medication, minimizing that dose as much as possible, or potentially getting them off of it. So yes, it can be done. It can be done by healing the gut. But, as always, we have to look at the whole picture, because sometimes there's other things in the way. Maybe they're living in a moldy home. Maybe they also have Lyme disease. Maybe they have blood sugar issues. So you always have to go back to healing the whole person. And then, yes, you can get into remission.
I love that. And to that point too about the medications, I mean, I know that some patients can improve when taking thyroid medications because, the synthetic hormones duplicate those made naturally by our thyroid gland, but it still won't resolve the issue of the immune system, attacking itself, for lack of a better word. But for a patient who opted to take synthetic thyroid hormones, but would like to pursue that more natural treatment approach, what tips do you have for that transition? So you had mentioned slowly starting to decrease that amount over time. Are there any other tips that you could offer?
Yeah. So, I mean, there's a lot of things, and really it takes a good practitioner to help guide you, right? If you're on medication, someone's got to be able to prescribe that. And if your primary care is not even open to the idea of, trying, let's say, natural desiccated thyroid or something like that, then that gets a little bit tricky. So finding a good practitioner to work with is really kind of part one, or, first piece. But, if they're on synthetic thyroid hormone replacement like levothyroxine or Synthroid, you may start with just decreasing the dose and seeing how their body responds. Also, a lot of people like to switch to natural desiccated thyroid like NP thyroid or Armour thyroid. And those medications can have their issues too. I'm not a huge fan of Armour thyroid. I see a lot of symptom reactions to that, but I see a pretty good response to NP thyroid. So some people like that. So NP thyroid, Armour thyroid, when we say natural desiccated, we're talking about glandulars. So they're medications that are taken usually from pigs, right? So they're extracting their thyroid gland and basically encapsulating that so we can use it. The benefit of doing that is it has T4 and T3 in it. When you're using synthetic medications, you only have T4. And I'll back up a little bit to talk a little bit about thyroid function. So most of what our thyroid gland makes, about 80%, is going to be T4, but T4 is not as active as T3. So we rely on things like the liver and the muscles and the nerves to convert T4 into T3. But if you have liver congestion, or fatty liver, right? If you don't have good muscle mass, you're not going to convert well. If you have a lot of stress, you're going to have trouble converting. So there's all these things that can impact that conversion. So if somebody's not converting well, then they're not going to feel well. So that's where doing something like a natural desiccated can help balance that out, because you're getting a little bit of both. So yeah, working with a practitioner, considering natural desiccated thyroid if you have poor conversion of T4 to T3, those are some of the main things I would think about, regarding medication.
Wonderful. And then in that same vein too, what are your top 3 natural integrative approaches to addressing Hashimoto's? And I know we touched on the stress management and diet, but maybe we can go a bit more into diet. I'm interested to hear your thoughts.
Yeah. So nutrition is a big piece. That's almost always where I start. Like nutrition, stress. Yeah, you nailed it on the head. Like nutrition, stress management, and building muscle. So on the nutrition piece of things, I am really a fan of doing elimination diets. I've done a lot of food sensitivity testing, IgG, food sensitivity testing over the years. And while I think it can be helpful, I find that the elimination diet gives me much better results. And so there's different types of elimination diets. Some people consider like a vegan diet elimination diet. I actually do more like, it would be closer to like a carnivore diet for elimination. And usually I start with just 2 weeks. And they may need to extend that longer. I usually don't go any longer than a month for most folks on that strict of a diet. But
on that topic, I've seen you post information on carnivore diets, and I think it's so funny because there's so much different literature out there on diets, but my understanding is that it can help address autoimmune disorders short term, right?
Yes.
But it's going longer term where it could present, issues in the future. So I think that's important for people to recognize too. What is your limit at which someone should stop that elimination?
Yeah, especially for women. Like, I feel that men are maybe more adapted to be able to do a carnivore diet more long term without many issues. But what I see in women is that they just start getting depleted, and it messes with their hormones, and it messes with and when I say hormones, progesterone, estrogen, testosterone, it also messes with adrenal function. So I think it's a good jumping off point. But eventually what I want is people to start reintroducing foods and then seeing how their body responds, right? So we go back to super simple diet that helps reduce the inflammation in the gut, allows the gut to heal up. And sometimes I'm doing other things to help with gut healing, marshmallow root and DGL and L-glutamine. Yeah, all those good things, right? So sometimes I'll incorporate those. Not everybody needs them, but when indicated. But yeah, the goal is to then reintroduce foods and see how their body responds to them so we can kind of find a group of foods that they do really well with. And sometimes what you find in that process is there's a food that you can have once or twice a week, just not every day, right? So there's some nuance that happens there. But my goal is to get more food back in, but I just use the elimination diet as a way to reduce inflammation really quickly, get their energy up, get their bowels calmed down, and get them moving forward.
And also, too, I'm just curious, what are your thoughts on, so for example, I have a gluten intolerance. So I choose to avoid gluten due to symptoms that present after I consume it, like brain fog that might last a while. I used to get hives. So people ask the question, okay, if you avoid a food indefinitely, the time or the day you introduce it back, is your body going to have this big reaction? So what are your thoughts on keeping something indefinitely, not even consuming it, versus limiting it or restricting it rather for 6 months or so, and then introducing it back into your diet?
It's a great question. I think so. There's a ton of nuance here. So let's start with gluten in particular. So we know that gluten causes what's known as molecular mimicry in the immune system. So when the immune system sees it, gluten or gliadin really looks very similar to thyroglobulin. And so if your immune system is seeing that as an enemy, right, then it's like, oh, okay, this looks close enough. I'm gonna stimulate that response. So is there a problem with removing? Well, and let me go back here too. So the other question always is too is it just how we prepare our food in the US, right? All the pesticides, right? Things that are sprayed on our food, because we know people can go to Europe and eat gluten who have problems here and don't have any
And be
problems over
fine.
there. Right. So I think environment plays a role in that as well. And just not just gluten, right? With all of our foods. So I think we always have to keep that in mind as well. But, if somebody is restricting a lot of food over long periods of time, can that then cause a greater reaction later on? I think so for some folks and in some cases. But is there a problem with restricting certain foods? Indefinitely, I don't think so. Just because, again, we're not dealing with an immune system that's functioning at optimal level, no matter how hard we try, right? The reality is like, if you go back to eating a certain way, if you go back to a stressful lifestyle, if you're not, building muscle, like all that can come back. So we do have to look at things a little bit differently with people who have this condition versus, somebody who has a normally functioning immune system. But there is nuance there. It gets a little tricky because I see there's people who come to me who are like eating next to nothing for long periods of time and their calories are low and they're not getting enough protein. And like, I need people well nourished. So I want them to eat enough food. But where they get that from, as long as they're meeting like good macros and making sure that our micronutrients are well taken care of, they're getting minerals, like all that stuff matters. So there's nuance there.
Right. What are your thoughts on the GAPS diet? I had actually done this 4 or 5 years ago to again address that chronic urticaria that I was diagnosed with. Doctor said it was idiopathic. We don't know why you're getting it. It's probably stress induced. So I obviously understood that there was a deeper gut issue. So heard about the GAPS diet, did it for probably at least 6 months, and my highs disappeared.
Yeah.
And I just noticed a complete remission, as you said before, of a majority of my symptoms. So just curious, have you had patients do that? What are your thoughts on that diet? And it is very restrictive for listeners. So you have to know what you're getting into before undertaking it.
Yeah, I think it's, similar to doing an elimination or carnivore diet. Like if you're getting benefit from doing that, I think that's really all that matters. And what I always try to remind folks is there's so many ways to get to the end point, right? There's so many different pathways that what works for one person is not going to work for the next person per se. Like I would say majority of my folks who do an elimination diet do really well with it, but I have a handful of patients that wasn't the best route for them and we had to do something different. So I think everything, whether it's AIP, autoimmune protocol or carnivore or GAPS or, whatever it might be, FODMAPs, I think there's a place for all of that. And it just needs to be individualized to the person. So as long as you're getting benefit, but again, kind of goes back to, all right, how long-term are you going to do this? And if you're going to be restricting majorly for long periods of time, how is that impacting mental, emotional health and physical health?
Right. No, couldn't agree more. And going back to the topic of exercise and strength training, that was one of the first content pieces you wrote for
Yeah.
WellnStrong, the strength training for Hashimoto's. I will link that article in the show notes for listeners. But what are your thoughts again on even just cardio, right? So you said strength training is obviously the most optimal. I'd like you to just touch on why. And then that versus cardio and why strength training might be better specifically for that cortisol reaction or response rather that maybe running or more intense cardio could cause.
Yeah. So strength training to me, like cardio has its place. So we'll talk about that. But training to me is like, man, that's medicine. Especially as we get older, we know, right? Sarcopenia is going to happen. So we're going to lose muscle mass over time. That's a natural process of aging. So we need to be combating that. And that starts like in our 30s, right? So we really need to build good muscle because what does that help? Well, especially for women, it protects our bones, right? It helps keep our bone, we're talking osteopenia, osteoporosis. Having strong muscles is going to, or strength training, I should say, is going to help with bone density. We also know that muscle is one of the main places that we convert T4 into T3. So, liver does a lot of it, but muscles are in there too. So if you don't have adequate muscle mass, you're not going to be able to convert well. So it impacts your thyroid function. We know muscle mass impacts our sex hormones like estrogen and progesterone and testosterone. It also impacts our insulin sensitivity. And we know a lot of women, again, with Hashimoto's have blood sugar dysregulation, or if they have polycystic ovarian syndrome, a piece of that is often insulin resistance. So we need to make sure that all of those things are well balanced. And honestly, I think strength training, just from like a mental perspective, reminds women that they can do hard things, right? That they don't have to be like, they don't have to hide, they don't have to, because like with Hashimoto's, I think a lot about women not speaking their truth or not feeling like they can truly be themselves. And I feel like strength training gives women confidence and gives them the strength that they need to live authentically and live a life that feels right to them and that feels like home to them. So that's why I'm really a huge fan of strength training. Cardio definitely has its place. Where we come up, against some problems is when, is with the cardio bunnies, where like all they're doing is on the treadmill all day long and they're not doing any strength training. I've had patients who are like marathon runners, and I can just see it in their blood work. I can see it in their symptoms. I'm like, your body's just tapped out. Because cardio, while it's great, we call it cardio because it's good for the cardiovascular system. There's definitely a big piece of that, but you have to look at the intensity of it. And you always have to include a little bit of strength training there. Like I also see women who are doing like HIIT exercises all the time. And it's like, you are crashing your adrenals, because it's exercise in and of itself, no matter what kind you're doing, is a stress on the body, right? But you have to choose that stress wisely. And I think when we're doing excessive cardio, that's sending a signal to the body, like, I'm always on the run, right? I always got to be going, right? Instead of like, hey, I'm cool, like everything's fine, I'm just strong and I got muscles, right? So
Yeah, no, and that was me, quite honestly. I would be at the gym running hardcore every single day. Like I recently got into weightlifting, but I think especially for women, it's very important to also recognize that we are on a different cycle than men, right? We have, 28-day cycle, and throughout
yep.
that cycle, you need to focus on different exercises at different parts of that cycle, right? To help optimize hormonal balance. So I think that's very important, because on day one, you can't be doing the same thing you'd probably be doing on day 28. And sadly, people stick to the same routine, and it's a disservice to their bodies. But I'm really glad you touched on that. And in that same vein as well, the topic of hormetic stressors. So these are stressors that are good for the body in the long term, but obviously uncomfortable in the short term. So they could be things like cold plunges or, very high intense exercise for a small amount of time. And we know that they do have quite a bit of benefit. So my question for you is, how do we balance that benefit in a patient with Hashimoto's who, you don't necessarily want to overstress their bodies? And what are your thoughts on, I guess, integrating some of those hormetic stressors into the routine?
Yeah, that's a great question. I would say it has a lot to do with time and place. So if somebody comes to me and their adrenals are just tapped out, their thyroid is really imbalanced, am I going to send them to go do HIIT exercises? No. We need to start gentle. Like I'll send them, I'm like, go do a daily walk for 10 minutes. Like I just need your body moving, but not stressing it out, right? But then as they improve and they get better, then I'm like, okay, now I want you to pick up some heavy stuff, right? I want you to do some weights. I want you to test it out and see how your body feels. And so as they get better, then they find they're able to do harder things, right? They're able to take on more of that stress. And I would say the other piece of it is teaching people how to be more in tune with their body. So many people are disconnected from their body. Like they don't even realize all the symptoms they're experiencing. Like they've got Hashimoto's and they've got all this stuff and it's very clear to me, but they don't even realize how bad it is, but until they start feeling better. But being in your body allows you to better assess, like, okay, I had that workout. How was my recovery? How did that feel? Did I do too much? Maybe I need to scale it back a little bit, using gauges, checking in with your energy and how your muscles feel and your recovery. All of that helps tell you, like, okay, am I on the right path or am I overdoing it? Or sometimes the question is, all right, is there something that is blocking my ability to push forward and do a little bit more? Maybe there's another imbalance that needs to be addressed or something's a little bit off. So really just gives us information. And it's interesting. I think it's been, So I got an Aura ring just recently. So yeah, I'm like,
I
okay,
want
12.
one of those.
Yeah, I just got it. And it's so interesting to me because it's, looking at your heart rate variability. It gives you like, what's your, recovery score, like how are you doing that day? How is your sleep? All of those things. So it's like, it's interesting. I think it's a good tool. Like it's expensive. So you definitely don't need this. There's lots of other ways to get in tune with your body, but it's been fun for me to see like, okay, is my gauge of how my body's feeling matching up with what data is being collected? Because then a lot of times I'm like, okay, like I am feeling that way. Like it's okay to like give into like, hey, I need to rest today, So it's just interesting. Getting in your body makes a big difference.
I love that. No, couldn't agree more. That is on my list. Maybe for my birthday, I'll request it. They are
Yeah.
expensive though, but again, anything that can help inform, insights into what's going on inside is always helpful.
Yeah.
We have covered so much. I am so grateful for you and this conversation. I already know this is going to help so many people. My last question for you, Dr. Stone, is what does being well and strong mean to you?
I love, love, love that question. To me, it means living life on your terms and doing the things that you want to do. And that's going to be because that's going to be a little bit different for everyone, right? I want to be able to, at least for right now, at this point in my life, I want to be able to hike mountains and I want to be able to play with my nieces and nephews, right? But, when I'm 50, that might look a little bit different. So to me, it means living life to the fullest in the moment that you're in. Because if you feel good, if you're strong enough to do those things, then sky's the limit.
I love that. That's beautiful. I couldn't agree more. And where can listeners find you?
Great question. So probably the easiest place is going to be Instagram because I've got tons of free material on there. And then in my link in my bio, you have access to my website and you can schedule virtual consults. So you can get a copy of my book. So if you're not on Instagram, you can definitely check out my website. Probably needs to update it sometime soon, but I don't know. I was like, you create it, then you forget about it. So drstoneaz.com. That's going to be my website. And then my handle on Instagram is drstoneaz. So Dr. Stone Az.
Wonderful. And I will link those in the show notes. I love your Instagram account. Thank you so much. This has been wonderful. And we will have you back on because there's, again, so many other areas that we just touched the surface of. But this was a great 101 basic session. So thank you.
Yes, thanks for having me. And I will definitely come back. Always a good time chatting with you.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit WellnStrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.